Thanks for inviting us in at 11. Hoosiers 45 and older are now eligible for the COVID vaccination. But tonight we're starting to see a few problems pop up. So for tonight's big story, we want to take a look at this growing reluctance among younger Hoosiers to get the vaccine. And a new tool on your iPhone tonight, making it easy to find a clinic near you. But we want to start with this issue for people waiting on their vaccine appointment. What happens if you actually catch COVID before getting your first dose?
I am probably banking 6 hours of awake time per day.
Nikki Miller is tired, and that's not even the half of it.
I can honestly say that this has probably been one of the worst sicknesses I've ever had.
Last Wednesday, Miller was diagnosed with COVID-19 after she started feeling sick on Monday.
It started with a dry cough and a pretty sore throat that started coming on, which I thought was kind of odd. And then by Tuesday afternoon, I felt like I got hit by a semi.
That's why you haven't heard her on 104.5 WJJK during the afternoon drive this past week.
And I'm going to try my hardest to get back on tomorrow here in Indy.
Miller was doing everything she could to avoid getting the virus. She even had her vaccine appointment scheduled for next month.
I could not wait to get that shot in my arm.
Instead, COVID-19 got to her first.
It finds a way in. I'm telling you, if you are down just a little bit, be careful, be extra cautious. If you're working a little bit too much or you're stressed out for a family situation or whatever the case is, that's when your immune system might take a halt, and that's all it needs.
Miller is more determined than ever now to get her vaccine when she's able to.
Just get that vaccine as soon as you possibly can.
Emily, I'm sure there are other people either in the same boat or hoping this doesn't happen to them. So if you catch COVID before your vaccine appointment, what do you do? What's the next step?
Well, the next step is to quarantine for the 10 days, for 10 days from the first symptom. And after that, you should be able to go and get a vaccine. So just wait 10 days. The old guidance was to wait 90 days, and that really was about vaccine supply. The idea was that if you had COVID, you had antibodies in your system to protect you from getting it again, from reinfecting. But that is all changed from the CDC. And we talked to one infectious disease doctor from IU Health, and here's how he explained it.
There is a recent study that shows that having a vaccine following COVID-19 works actually as a booster of the immunity. So your antibodies and all your immune system will actually get a boost from the vaccine, and you'll even be protected far more than the patients that are not vaccinated at all.
So the idea is, after you've quarantined for the 10 days, to go ahead and get that vaccine again, that basically you'll have even extra protection, that the vaccine right after COVID actually acts as a booster. Scott?
Very interesting. Emily Longnecker, thanks. Even as our state lowers the vaccine eligibility to Hoosiers 45 and older, clinics across Indiana are running into an unexpected issue.
Younger people becoming eligible to receive the COVID-19 vaccines may not be willing or eager to get the shots. This IU Health Clinic is finding that as the age eligibility goes down, the number of unfilled appointments is going up. A nationwide survey found that only half the people aged 45 to 59 were already vaccinated or definitely would be. That compares to 70% of those 60 and older.
Tonight we decided to take a closer look at Indiana's vaccine numbers by every age group. These are all the people who've had at least one dose of either the Moderna or the Pfizer vaccine. Now, the three oldest age groups, Hoosiers 70 on up, have had at least 70% in each age range getting vaccinated. Now, when we move into Hoosiers in their 60s, we're beginning to see a little bit of a drop-off. 59% of Hoosiers 65 to 69 have had a shot, and only 37% of Hoosiers over the age of 60 have had one of the vaccine. Now, the numbers drop even further as we look at Hoosiers in their 50s. I'm in this age group. Only 24% of Hoosiers 55 to 59 have had at least one shot. Only 19% of Hoosiers 50 to 54 have been vaccinated. Now, it is worth noting that several thousand Hoosiers got the one-dose Johnson & Johnson vaccine, and those numbers are not reflected on this graph. Now, we just saw the vaccine open up to Hoosiers who are 45 and up. We're going to be watching to see how these younger age groups respond in the coming weeks. So as we wrap up tonight's big story, here's a new tool you can use to find your nearby COVID vaccine clinic. A new update in Apple Maps tonight includes labels for nearby locations. So all you have to do is ask Siri, where can I get a COVID-19 vaccination? You still have to sign up through our state's website, but this can help you find the nearest clinic in your area.